Assalamu alaikum. I am Dr. Khatija, Bosundara Adin Medical College. Today I am going to discuss about normal body temperature. What is body temperature? The degree of hotness and coldness of the body is called temperature. Normal body temperature is usually measured by degree Fahrenheit or Celsius. In degree Fahrenheit it is about 97 to 99 degree Fahrenheit, and in Celsius it is 96 to 97 degree 7.5 degree Celsius. There are two types of body temperature, that is core temperature and shell temperature. Core temperature, the temperature of the body deep to the tissue. It is determined by measuring rectal or oral temperature. And shell temperature, the temperature of the skin, it is determined by measuring temperature under the axilla, that is in the skin. Normal body temperature, that is measured orally, that is 98.6 degree Fahrenheit. Rectally it is 1 degree higher than oral temperature. In axilla it is 1 degree less than oral temperature. These are the common sites for measuring temperature, and this shows the difference between core and shell temperature. Core temperature usually remain constant. It is more accurate, and it is determined by measuring per rectally or orally, and generally more than shell temperature. Shell temperature is usually rises or falls with the surrounding, and it is determined by measuring axial temperature, and generally less than core temperature, and it is less accurate. So why do we need to regulate internal body temperature? That is to provide optimum condition for enzyme catalyzed reactions to be carried out. Temperature above the normal level, that is the 37 degrees Celsius, may denature enzymes and block metabolic pathways, and temperature below the normal level slow down the metabolic activity and affect the brain. So control of body temperature, that is controlled by balancing heat production and heat loss. Now we are going to know there are two types of animals that present in the world, that is homeothermic or warm blooded animal, and poikilothermic or cold blooded animal. And homeothermic or warm blooded animals are capable of regulating blood temperature within a narrow range despite of wide variation in outside the temperature. Usually mammals, that is human being, are warm blooded animals. And poikilothermic or cold blooded animals are not capable of regulating body temperature within a narrow range. Rather body temperature varies within the environment, within environmental temperature. Reptiles, snakes, these are the cold blooded animal. Now we are going to know what is set point. Set point is a critical level of body core temperature, that is 37.1 degrees Celsius or 98.8 degree Fahrenheit. Above or below this drastic changes occurs in rate of heat loss and heat production. So below the set point, rate of heat production is greater than that of heat loss, and body temperature rises and regain its set point. And above the set point, rate of heat loss is greater than that of heat production. So body temperature falls and regain the set point. Regulation of body temperature, a mechanism of balance between the heat production and heat loss. So the rate of heat production is greater than that of rate of heat loss, so body temperature rises and vice versa. So what are the procedure of heat production in your body? First, BMR, that is the basal metabolic rate of all cells, and increased muscle activity, that is shivering, causes extra rate of metabolism. And also hormone, like thyroxine, increases metabolic activities of almost all tissues of our body. And also epinephrine, and norepinephrine and all sympathetic stimulations, it also increases heat production. And also increase chemical activities that causes extra metabolism. And meal that is after meal causes extra metabolism. Now what are the mechanism that body loses heat? These are the radiation, conduction, convection, evaporation, respiration, urination and defecation. In this figure, students, you can see the different types of mechanism how the body loses temperature. You can see that radiation is the most, by radiation most temperature is lost, that is 60%, and secondly evaporation, that is 22%. Another are that is conduction, that is 3%. So what is radiation? Loss of heat by radiation means loss in the form of infrared heat rays. The human body radiates heat ray in all directions. Heat ray also being radiated from the wall of a room and other objects towards the body, that causes, that is 55%. And then conduction, it is a heat exchange between objects or subject at different temperature that are in contact with one. It is about 3% and are normally lost from the body by direct conduction from the surface of the body to solid objects such as chair or bed. Convection, the removal of heat from the body by convection air current in commonly caused heat loss by convection. Actually, the heat must first be conducted to the air, and then the air is carried out by convection of air current. Now we are going to know how body temperature is regulated by the hypothalamus. You know, temperature regulation center is present in the hypothalamus. Firstly, body temperature is regulated almost entirely by the nervous feedback mechanism. Feedback mechanism operate through the temperature regulating centers located in the hypothalamus. Thermostatic detection, that is determined by the changes in the body temperature under various conditions. Regulation of body temperature, there is two areas we know present in the hypothalamus, that is anterior hypothalamus and posterior hypothalamus. Anterior portion is responsible for in any change in hot weather and this regulation of heat in hot weather, and posterior hypothalamus is responsible for regulation of body temperature in cold weather. Anterior hypothalamus, that is preoptic area, a thermostatic body temperature control center occurs here, and thermoreceptors, that is present in skin and deep tissues of the body, play important role in temperature regulation. Posterior hypothalamus, that is signals from preoptic area and peripheral and thermosensitive receptors are integrated to control heat conservations and heat production reactions and heat producing reactions. Now we are going to discuss about how hypothalamus regulate body temperature. Hypothalamic temperature regulating center detect that the body temperature is either too high or too low, then institute appropriate temperature decreasing or temperature increasing procedure, then eventually body temperature back to the normal. Now what are the temperature decreasing mechanisms? Increase in heat loss by vasodilation of skin vessels, that increases the rate of heat transfer to the skin caused by the inhibition of sympathetic centers. Then sweating, increasing body temperature raises the rate of evaporation is also increases by sweating, and decrease in heat production. How heat production decrease? It is by inhibition extra metabolism, chemical thermogenesis or shivering. Now temperature increasing mechanisms are that decrease in heat loss, that causes by vasoconstriction of the skin blood vessels, causes by stimulation of the sympathetic center, and by piloerection, that is hairs ending are standing. It is caused by the contraction of the piloerection muscles of the hair follicle by sympathetic stimulation, not important in case of human being. And behavior like that is wearing well illustrated clothes, light cloth, increasing heat production by thermogenesis, by increasing activity, that is shivering, sympathetic excitation, and increased thyroxine secretion. Now in flowchart we can see how temperature decreasing mechanism occurs when body is too hot. Vasodilation of the skin of the blood vessels in hot climate, that is inhibited by the sympathetic stimulation in posterior hypothalamus. Then dilation of the blood vessel occurs, increased blood flow to the skin, and production of conduction of heat from core to the body skin with great efficiency. Conduction of heat from core to the body to the skin with great efficiency, so increase heat loss and increase the decreased body temperature. In case of sweating, excess heat production occurs in body, then stimulation of the sweating center, that is is present in preoptic area of hypothalamus. Cholinergic sympathetic discharge occurs and increased sweating. Then increased sweating causes heat loss along with the sweating by the process of evaporation. Number 3, decreased heat production by shivering and chemical thermogenesis are strongly inhibited, and so the body temperature decreases. Now, how body temperature is maintained in cool climate? Firstly, when there is cool climate, exposure of cold, that causes cold receptors of the skin send sensory signal to the cold sensitive area of the hypothalamus. So, stimulate temperature increasing mechanism of the hypothalamus. So, in this case, vasoconstriction occur of the skin in cold climate, vasoconstriction of the peripheral vessels. So, decreased blood flow to the skin, and so decreased blood flow to the skin, and so heat loss and body temperature increase. Number 2, increase in thermogenesis, that is heat production increases by increasing metabolism by shivering, sympathetic stimulation, and thyroxine secretion. How shivering causes increased temperature? By shivering, cold signals are transmitted from the skin to the spinal cord, stimulate the dorsomedial portion of the posterior hypothalamus. So, discharge rhythmic signals to the skeletal muscle, so increase muscle tone, and so shivering begins, and then heat production occur. By sympathetic stimulation, chemical excitation of the heat production occurs by increasing sympathetic stimulation or circulating norepinephrine, epinephrine, and epinephrine in the blood, increase rate of cellular metabolism. So, body temperature increases. By thyroid hormone secretion, that is cooling of the anterior hypothalamus preoptic area, increase release of thyrotropic releasing hormone, increase secretion of thyroid stimulating hormone from the anterior pituitary gland, and then stimulation of the secretion of thyroid gland for secretion of thyroid hormone. So, cellular metabolism increases and increase heart rate. So, these are the mechanism how body temperature is regulated in cold weather and also in hot weather. Now, I am going to discuss what is heat stroke. When the body temperature rises beyond a critical temperature into a range of 105 to 108 degree Fahrenheit, the person is likely to develop a condition called heat stroke. What are the symptoms? Symptoms are dizziness, abdominal distress with vomiting, delusion, loss of consciousness, and circulating shock, and frostbite. It is another condition when body is exposed to extreme cold temperature, that is surface area can freeze. The freeze is called frostbite. This occurs especially in lobe of air and the digits of the hands and the feet. Now, what is fever? It means when body temperature rises more than normal, it is called fever, and can any abnormality occurs in the brain itself or by toxic substance that affect the temperature regulation center. Body temperature can rises from the normal. This is a clinical condition. It is a symptom but not a disease. So, that is all from today. Thank you for watching.